For today's topic, let's talk about meningitis. Meningitis is inflammation of the meninges and the subarachnoid space. The meninges are the protective membranes that covers the brain and the spinal cord. The meninges have three layers: the dura mater, which is the outer layer, the arachnoid mater, which is the middle layer, and the pia mater, which is the inner layer. The subarachnoid space is found between the arachnoid mater and the pia mater. It is filled with cerebrospinal fluid and blood vessels. The cerebrospinal fluid is a clear, colorless liquid that circulates around the brain and the spinal cord. The cerebrospinal fluid, or CSF, acts as a shock absorber to cushion the brain and spinal cord against injury. It also provides them with nutrients, removes waste, and maintains their chemical stability. So the cerebrospinal fluid is composed of water, which accounts for a majority of its contents, along with protein, glucose, and electrolytes, accounting for different amounts such as sodium, potassium, chloride, calcium, magnesium, and of course, a few white blood cells. The CSF usually has a pH of 7.28 to 7.32 and a total circulating volume of 150 milliliters. The blood-brain barrier is a highly selective and semipermeable membrane of endothelial cells that protects the brain from toxins, pathogens, and harmful substances while regulating nutrients transport. So it basically decides what goes in and out of the CSF. So for meningitis to happen, there has to be an invasion of the meninges by organisms. These organisms can be bacterial. In neonates and young infants, the most common causes of bacterial meningitis are Streptococcus agalactiae, E. coli, and Listeria monocytogenes. In older infants, children, and young adults, the most common causes are Neisseria meningitis and Streptococcus pneumoniae. In middle-aged and older adults, Streptococcus pneumoniae is a common cause, but in people of all ages, Streptococcus aureus occasionally causes meningitis. The viral causes are mainly associated with enteroviruses, but herpes simplex virus, West Nile virus, and HIV can all cause viral meningitis. Fungi usually are rare but is caused by Cryptococcus. Parasitic meningitis usually associates with a tapeworm infection in the brain or cerebral malaria. TB meningitis is caused by Mycobacterium tuberculosis. Non-infectious causes are associated with autoimmune conditions, drugs, vaccines, head injuries, and cancers. But generally, viral and bacterial meningitis are the most common causes for meningitis. The overall immune responses to meningitis causes pressure to increase in the cranium, glucose decreases, protein increases, and white blood cell increase. Meningitis can be spread through respiratory or throat secretions depending on the cause, but not all forms of meningitis are contagious. The classical triad of symptoms for meningitis are headache, fever, neck stiffness, altered mental status, and photophobia. So let's look at the clinical signs. So checking for the Kernan's sign. The Kernan sign is where the hips are flexed at a 90-degree handle, but a person is unable to extend their knee. So a positive Kernan sign for meningitis is where there is pain and resistance to knee extension. Then there's also the Brzezinski sign, and a positive Brzezinski sign for meningitis shows a full or partial flexion of the hips and knees when the neck is flexed. Diagnosing meningitis can be done through various tests. Cerebrospinal fluid analysis is done where a lumbar puncture is made at L3 and L4 of the spinal cord. CSF is then taken and analyzed for white blood cells, protein, and glucose. Now, PCR is done for suspected causes of meningitis to check for HIV, enteroviruses, HSV, and TB. Western blot test is done for specific bacteria, for example, Borrelia burgdorferi, or in some cases, A blood culture can also be done. Meningitis is treated depending on the cause. Bacterial meningitis is treated with corticosteroids and then antibiotics. There are specific drugs like antibacterial for bacterial meningitis. Fungal meningitis requires antifungal agents. Parasitic meningitis requires antiparasitic agents. Viral meningitis is typically self-limiting and it requires rest, hydration, pain meds, and antivirals. Vaccinations and chemoprophylaxis are given for prolonged close contacts. And that's it for today's video. Thanks for watching. Don't forget to like, share, and subscribe. See you in the next video.